type 2.
Dr. Yasmine Shalaby. She is an internationally trained dentist and she has more than 5 years of experience in clinic management, insurance, and administrative work. Upon coming to Canada, she became a certified Ontario medical, legal, and community interpreter, where she helped refugee newcomers and immigrants with their new life and the daily challenges they face. She demonstrated respect for person and impartiality, a high degree of confidentiality and professionalism. Dr. Shalaby pursued the bridging program for internationally trained medical doctors at Ryerson University as a part of her continuous professional growth. She has a passion for research and global health studies and worked on projects focusing on maternal and child health. She is a member of Canadian Coalition for Global Health Research, where she shares a particular interest in knowledge translation and policymaking. Dr. Shalaby always looks for opportunities to give back and uses her skill and her medical background to contribute to team success. Dr. Shalaby, we are very pleased to have you here with us tonight. You can start your presentation now. Thank you.
Thank you so much, Mitila. Thank you. If I may share my screen.
Yes, all is yours.
Thank you. Well, good evening, everyone, and thank you so much, Dr. Shafi, for this wonderful opportunity. Yeah, okay. Today, I'm going to talk more about live longer with diabetes, but I'll be more specific into the intervention for prevention. What kind of interventions do we have to prevent diabetes? And we're talking particularly type 2 diabetes. Type 2 frequency increases 44% between the years 2015 to 2022, with, of course, 2 to 3 times more hospital visits. And type 2 diabetes has many factors that increases its incidence, including poverty, inequality, aging, poor nutrition, food insecurities, low education, environmental pollution, and genetic factors. There are also so many other risk factors enhance the prevalence of diabetes, example, advancing age, obesity, physical inactivity, ethnic background, and family history. Obese adults are 2 to 4 times likely to have diabetes type 2. And in 2009 to 2010, almost half of the Canadians aged 12 years and older reported they are physically inactive and that they are also eating less than 5 times a day of vegetables and fruits, which is considered unhealthy diet. With increasing rates of obesity, the risk of diabetes is expected to increase, of course. However, Canadians can reduce their individual risk by being physically active and by maintaining normal weight or at least losing the excess one. During the COVID-19 pandemic, it has clearly exposed the relation between non-communicable disease, infectious diseases, and the broader social, economic, and commercial determinants of health. People with diabetes have 2 to 3 times increased risk of COVID-19, unfortunately, compared with individuals without diabetes. And this risk is increased in conditions where there is poor glycemic control, or I would say uncontrolled diabetes, or with diabetes-related complication existing, and also with social conditions in the less privileged communities where they have lower access to care and higher rates of comorbidities. Well, in the World Diabetes Day 2018 campaign, it promotes for universal health coverage, which include improving the knowledge and the capacities of people with diabetes and their families to take charge of their own care and to reduce economic hardship in households. The evidence base for improving diabetes prevention and care is strong, and the WHO is announcing the development of the WHO Global Diabetes Compact to be launched in April 2021. Through the compact, the WHO will work with partners to support countries mobilize resources in order to enable for better access to essential diabetes medicines, inclusion of diagnosis and treatment of diabetes in primary health care, reduction in major population level diabetes risk factors such as, of course, obesity, and for the universal health coverage packages. This initiative is a very valuable opportunity to build partnership between governments, care providers, patient advocates, and non-governmental organizations, which will, of course, enhance or implement recommendation through a renewed global diabetes movement. Various diabetes prevention program studies have been conducted around the world. And for the prevention of type 2 diabetes programs, they are effective in helping individuals with high risk or at risk to lose their weight and lower their blood sugar level, and of course, delay the onset of diabetes significantly. And also the American Diabetes Association recommended intervention for preventing or treating diabetes and its complications to be considered very effective, very cost effective for all which relieves the burden on all health systems. To our knowledge, there is only one national diabetes prevention program in Canada, currently funded by the Public Health Agency of Canada for less than 4,000 individuals. Diabetes Canada has lamented that Canada doesn't have a coordinated set of policies for diabetes prevention and treatment. Although Canada is rich in the prevention-related services, but there is no mechanism to package them into structured, personalized, and coherent prevention programs. Thus, further researches are required to develop models that predict good outcomes. Ironically, type 2 diabetes is preventable, and prediabetes is a condition that leads to the development of type 2 diabetes in more than 50% of the people who have it. However, its onset can be delayed, or even prevented using proved approaches. As Dr. Shafi mentioned earlier, unfortunately, Canada engagement in this program is very low and needs to be improved. Where other countries as Finland and Australia have invested in infrastructure for diabetes prevention for over a decade and have many citizen accessible programs. But luckily, we are having a promising Canadian intervention is preparing on the time being, which is the PREVENT program. It uses evidence-based guidelines to prevent diabetes and its associated complications. A team of researchers and scientists from the University of Toronto and Ryerson University are working together to create a Canadian proactive ecosystem for values, exercise, nutrition, and therapeutic, which is PREVENT, for identifying, informing, and educating, assisting, and supporting to help pre-diabetic individuals to be able to lower their risk and delay or prevent future onset of diabetes. The PREVENT team will be able to have a superior ability to gather data, analyze, and act in response to what we understand, which will assist in decision-making, make more sound and more informed decision, and support interventions and support maintenance of prevention activities, and will enable incorporation of these into virtuous cycles of learning, autonomy, and changes at the end. So we're all looking for this wonderful, promising intervention to happen one day soon. These are my references for further reading, and thank you so much. Thank you for listening. Thank you so much.
Thank you. Thank you.